All right, this is Melanie Philofsky, and this is the Electronic Health Record Working Group May 2021 update. So these are objectives and results for 2021 is to provide support for the transformation of source EHR data to the CDM, so OMOPing your data. We also discuss and provide guidance on CDM logic and conventions. Also, whenever the CDM Vocabulary Workgroup has a new proposal for changes to the structure of the vocabulary of the CDM, we also discuss those and provide feedback. We're here to help each other learn from our experiences, and we also discuss any other OHDSI, CDM, or electronic health record topic. So our first key result is an up-to-date list of educational and collaborative resources on the MS Team site for those OMOP their data to the CDM. We haven't started this yet, but it does include procuring and maintaining a list of OHDSI and OMOP ETL educational materials. Currently, they're spread over many different things between GitHub, the Book of OHDSI, and tutorials. So we would like to put those in one spot. I would also like to establish an OHDSI member-to-member support network or some type of mentoring program. I think this is very important, especially for EHR data that's coming from certain vendors. If we could connect people that have ETL their data from Cerner, Epic, any of the big names. There's a lot of people out there that have done this work and can provide some guidance. So setting up a mentoring program, I think, would be very helpful to the new folks coming to the community. And then also creating a guide of published or presented work on others' experience mapping EHR data to the OMOP CDM. There's been a lot of, many people have published or presented their work, especially for the OHDSI Symposium. So I think having that all in one spot where it's easily searchable on this particular topic would be helpful. Our next key result is we review all the CDM and vocabulary changes that the CDM Vocab Workgroup puts out. And this is an in progress and continuously ongoing. So we actually just discussed last week during our meeting the proposal for CDM version 5.4, and we're prepared to give feedback to the CDM Vocab Workgroup on the proposals. And then next, key result 3, to identify the knowledge gaps and then invite subject matter experts to present at our sessions. This is also something that's in progress and will be continuously ongoing. And we identified those knowledge gaps at the beginning of the year with a meeting poll that was completed. And from there, that informs us what the different topics will be for the year. And so far, we've had Christian Reich present on the wide mapping table last month or 2 months ago now. And then in the future, we are going to join the clinical trials work group to get an idea of what they're doing and how the clinical trials in the EHR, where they intersect, especially during like ETL and the different data points that we have. Kristen Koska is going to present drugs for research in July. Claire and Frank are also going to give us updates on the data quality dashboard over the past year. We don't have a date for that yet. And then I've also reached out to other folks about presenting for our various topics this year. Another thing we do is we also provide open discussion meetings on a regular basis so that the OHDSI community has an opportunity to bring new or urgent topics up for discussion. And we pretty much have one of those meetings. So far, we've had one in February, March, and April. And we continue to provide that on an ongoing basis throughout the year. That is us and what we do. We meet every other Friday at 10 a.m. Eastern time with our next meeting on May 14th. And you can find us on MS Teams as the EHR Working Group, OHDSI.org, the wiki, the project, the work groups. You can find us there. You can also find us on the forums if you search EHR data to OMOP CDM Workgroup. Or you can email me, Melanie Philofsky at Odysseusincorporated.com. Everyone is welcome to our working group. Come join the journey. Thank you, Craig.